I was actually first introduced to you through an article that you wrote entitled, "I'm a Doctor, You Shouldn't Always Trust Us." And that just stuck out to me. My father's a doctor, my mother's a doctor. I work with doctors all the time. Oftentimes they are not trusted and sometimes complain about that, but it was a poignant article. It was very emotional, heartfelt. Can you tell us about that story and what basically got you to finally write that and release that to the world?
Ooh, absolutely. I think the real crux of why I made a statement that bold comes down to a simple reality that I did not fully understand when I entered the medical system, but I certainly awoke to 9 years into my training, which is that the reality in America is that every institution that touches our health, from the doctor's office to the hospital to the pharmaceutical companies, even the insurance companies, they make more money when we are sick and they make less money when we are healthy. And that's just the stark economic reality of it. And so you are working in this system that you have gone into as a doctor with the best of intentions. Every single doctor I know, probably like your father and many that you know, went into medicine to help people. But the reality is that healthcare is a business and that business is designed to grow. And healthcare is actually the largest and fastest growing industry in the United States. It's over 20% of our GDP. And that reality of the fact that it is a business designed to grow in the economic model right now is predicated on growth being related to more patients in the system for a longer period of time, having more things done to them. What that does is it creates a massive invisible hand that unfortunately influences and corrupts every aspect of our medical culture to not be focused on actually preventing and reversing disease and promoting human flourishing and thriving, which of course would get people out of the system, and instead promotes a system from the medical education to the how research is designed and done to how doctors practice that is fundamentally focused on waiting until symptoms and diseases emerge and then doing things to the patient. And we've seen the chronic disease explosion over the past 50 years, with really disease being so much more of a long-term thing that we manage as opposed to what it used to be, which is really acute issues, things that would crop up and the medical system would intervene and, people would be on their way. Now we're seeing these diseases that start young and go on for decades. And frankly, chronic disease is the ultimate economic boon for our healthcare system because you have people that need to be quote unquote treated or managed for life. This is extremely, extremely profitable. And so what you see happening, unfortunately, because of these economic realities is that we actually, as a doctor, we are literally not even trained to understand the root causes of disease or the connections between these seemingly different chronic diseases that we're facing in the United States. And instead to just really look for these downstream symptoms and signs and manage them. And so this is why what we're seeing is that as we spend more every single year on healthcare, literally increased spending every single year, outpacing the rate of inflation, the outcomes are actually getting worse. So the more we spend, the worse the outcomes are getting. The more we spend, the more life expectancy is declining. And so there's clearly something that's not right. And I think that the message that I'm trying to get across is we all, as individuals and doctors, need to wake up to the realities, the true foundation and structure of this system, and just be eyes wide open so that we can start to advocate for our own health and for our own thriving, because unfortunately the system's not incentivized to do that for us. And so the book is fundamentally about this from the inside perspective I had as a head and neck surgeon who had been deep in the belly of the beast, climbing that ladder, believing in it, and then really having a disillusionment when I was so deep in it. And also my mother's story, who is unfortunately, tragically, one of the victims of this system, where she had so many of these symptoms and diseases sort of start to accumulate throughout her life, like so many Americans do. All the sort of rites of passage of American life, the high blood pressure, the high cholesterol, the high glucose levels, the weight gain. And in our system, unfortunately, all the different specialists saw these as different things, didn't really look for that root cause, didn't see these emerging diseases and symptoms as fundamentally signs that there was an underlying core problem and addressing that. And so she fell prey to whack-a-mole reactive medicine and ultimately got a cancer diagnosis that took her life. And my mission with this book, Good Energy, is to show people that what we actually know is that almost every chronic disease in the United States right now is fundamentally rooted in metabolic dysfunction, which is addressable and reversible. And we have to start looking at that upstream cause, tying these conditions together, focusing on the real problem. And I think what we would find if we did that, if we pointed that $4 trillion arrow towards the right problem proactively, a lot of the suffering in our country would melt away and we'd avoid a lot of these lethal diseases that fundamentally we are getting so many signs and signals of early on, but we're just not seeing them for what they are, which is early signs of metabolic dysfunction that can be addressed and reversed. So that's really the call to action of Good Energy, is a reimagination of how we practice healthcare in the United States, and a sense of empowerment for people to take their metabolic health into their own hands.
It's really interesting because as someone that went to business school, I kind of understand where healthcare is coming from. The companies, their fiduciary duty to their stockholders is make money. And so you could understand it's really sick care system that is all profit driven. And of course, you'd want to teach the doctors to stay in line with that system and continue to make more and more money, as we've seen throughout the pandemic, throughout all, the past few decades. These companies have made much more money